Good evening, everybody, and thank you for joining us tonight for an update on the Sunningdale Health Hub project. We've had a few more people registered to attend this evening, so I'm just going to give it a couple more minutes before we get going with the information. Thank you. Okay, I think that's enough time. So just a quick introduction from myself. My name is Nick Vose. I'm a director of a company called Marengo Communications. I will be chairing this evening's session on behalf of you and putting your questions to tonight's speakers. Before I introduce the speakers, I'll just explain a little bit about this software and a bit of housekeeping. To your right-hand side, you'll see a panel where you can ask questions. Please put your questions into that tab as we move through the presentation. We'll look to take those at the end. If you can help me by making your questions on a single issue, that will just really help me put those to the team later. If you have a particular issue or a particular question you'd really like to see answered, you can upvote that. So there's an upvote function. You just click that, and that will give me an indication of how many people would really like us to discuss that issue and answer that question. Please also use that tab if you have any technical difficulties. Okay, I'm just going to ask all of our speakers one by one to briefly introduce themselves. Caroline, first to you.
Hello, I'm Caroline Farrer. I'm the Executive Place Managing Director for Royal Borough of Windsor and Maidenhead, and that's the joint role between NHS Friendly CCG and the local authority.
Fantastic, thank you, Caroline. Alex.
Hi, good evening. I'm Alex Tilley. I'm Director of Operations in the team at Royal Borough of Windsor and Maidenhead on behalf of Frimley CCG Clinical Commissioning Group.
Excellent. Thanks, Alex. Jackie, can I bring you in, please?
Hi there. I'm Dr. Jackie McGlynn, and I'm a GP partner at King's Corner Surgery.
Lovely. Natasha?
Hello, Dr. Natasha Price, GP partner from Magnolia House Surgery.
Fantastic. James, please.
Good evening all. James Lacey, Vale Williams, Planning Consultancy, been involved in the project last couple of years.
Excellent. Mark, over to you.
Hi everyone, my name is Mark Levinson. I'm a partner at Murphy Phillips Architects and we are overseeing the design.
Fantastic, thank you everybody. We also have a couple of people on our subs bench, which I will bring in later if we need to. We have Sarah, who is a colleague of James's and also a planning consultant, and we have Kath, who's also from the CCG and is the project manager. Okay, so I'll just briefly run you through the agenda. We have got quite a lot to cover. We're going to try and speak for no more than 30 to 40 minutes, and then we'll move on to your questions. We're going to kick off with Caroline, just providing us a bit of a recap and some of the information as to why the CCG are looking to make this change. We're then going to move on to Alex, Natasha and Jackie, who are going to talk a bit about what the CCG have learned from COVID-19 and also what real difference that the Sunningdale Health Hub can make, in particular, the services, the new ways you'll be able to access your GP, and then also some patient case studies that really bring what we're talking about this evening to life. We're then going to move on to James, who's just going to provide you an overview of the planning, and I'm sure many of you will have a knowledge of that already. And then we're going to bring in Mark, who's going to quickly talk us through the key improvements that we've made to the Sunningdale Health Hub. I will then come back at the end and we'll do the Q&A session. We'll try and get through as many of those as possible this evening. We are recording this session and we will make it available on the CCG website after this event. Caroline, over to you.
Thanks, Nick. Sorry, just unmuting that. Yes, just to recap then on the case for change. So as I think many people will be familiar with, we are seeing demand for services increasing due to the growth in the local population and the increasing healthcare needs of an ageing population. So this is the growth isn't astronomical, but it's crept up over a number of years and it's due to increase a little bit more. But the big issue for us is that Magnolia House Surgery and King's Corner surgery premises are just not big enough now. They've not been big enough for some time and they're not fit for purpose. They can't be expanded to meet the current and future demand. And one of the issues it brings with not having sufficient suitable premises is that starts to introduce issues with the recruitment and retention of staff into general practice and the ability to train new practice professionals, including GPs and nurses, due to the lack of space and poor working conditions. And over time, what tends to happen, and we've seen in other areas in experience, is that practices increasingly start to lose staff, and then that puts the very existence of general practice in a local area at risk. And then fourthly, our estate is a really big barrier to implementing new models of integrated care that are designed to prevent ill health and improve health outcomes. So as I said at the beginning, we do have an ageing population. We have a lot of elderly people in the local area. That's only going to increase, as I'll come on to in a minute. And what that means is they're the heaviest user of general practice services in the main. And to support them better, we need a wider range of health and other professionals involved in their care. But it's not possible to do that without larger premises. And so a planning application for a new health hub on land next to Linwood Village was submitted last year. Next slide, please, Nick. So, as I said, the complex health needs of our ageing population do mean that we need a wider range of services from health, social care, community and the voluntary sector. At the moment, our district nursing services are delivered from Bracknell for the local area. Our community nursing service, community maternity services have had to be located back into hospital from general practice due to a lack of space in the current premises. That is against the direction of travel nationally, which is for better maternity services to be co-located in the same building as general practice. Our physiotherapy services are currently based in Bracknell. For people with poor mobility in the first place, that's quite difficult. Then there's insufficient room for things like talking therapies and wellbeing services, such as citizens' advice and voluntary services. And also where people have complex needs or are at risk of abuse and neglect, then it's more difficult to do partnership working to reduce the risks of safeguarding issues. Next slide, please. So these are population projections. As I said, the growth isn't astronomical. It's about 5% over the 20-year planning period. But I think what you will notice is that most of that growth at the moment is in the older population, so 65 to 84, where there is a lot of use of long-term condition services provided in general practice and community services, and then very significant growth in the numbers of people aged over 85. And we do care for most of those people for most of the time at home in the community, and the use of residential nursing and acute services, relative to the size of the population, it is not as large as it once was, because we're trying to keep people at home where they want to be, independent and safe. Next slide, please. And there's just that bit more detail about the over 80s, where you can see that growth in particular in the over 85s, but also in those other age groups over 80 is really very significant. Next slide, please. And the population pyramids show, as you can see, around the early 20s, we don't have a lot of people, late teens and early 20s, probably because we don't have a higher education institution in the local area. These are figures for the whole of the borough, but there's quite a shift from the middle-aged into the early and older retirement ages of over 60 and above. Next slide, please. So one really good question that we've been asked when we decided to resubmit the scheme was, what account had we taken of all the changes that have happened during the pandemic to how general practice has been delivered? So Alex and Jackie are going to come on in a bit to some more detail about those changes. But actually, we've had a really good look at this and a really careful think about what it is that we needed to do differently. So we have seen a significant shift to more digital services and telephone consultations. But we know that face-to-face appointments are still really wanted and needed in general practice, and that we do need to be offering that to our local population, that people want it, people want to see their GP face-to-face. And we know that things like some areas, such as early cancer diagnosis, have really reduced, and now we're starting to see some late cancer presentations in our hospitals because we haven't picked things up early. And it's often in those face-to-face appointments where these kinds of things are picked up. And so we will continue to need a significant number of face-to-face rooms. However, so what we've done, yeah, so just to talk through the detail of this then, in the submitted scheme in 2020, we had 35 face-to-face rooms, but by taking account of digital and telephone ways of working, we've reduced that to 27. And also by rather than having lots of separate face-to-face rooms for physiotherapy, we've got some, but also put in a gym for the physiotherapy service, so that a lot of that work is done in the gym rather than in separate consultation rooms. So that's a reduction of 8 face-to-face rooms. Next slide, please. But what we also realised as we were doing this planning is that because of the additional roles that are being invested into general practice in the next few years, actually the old scheme, last year's scheme, wouldn't have been big enough, and we would have needed an additional 3 rooms. So actually the total saving is 11 rooms on the old scheme, and that would have added 300 square metres to the ground floor. Next slide, please, Nick. And then I think I'm handing over to Alex.
Thanks, Caroline. So as we're all aware, we've had some significant challenges through the pandemic over the last 15 or so months. General practice has maintained services throughout, and it's really important we learn from those challenges. So the infection control arrangements around a pandemic scenario has really created problems for our premises that we're talking about this evening. Non-purpose built health premises, converted houses, etc. do not allow for the circulation and the infection control arrangements we need. Neither sites work well with a one-way system, and that's really important to keeping our infections down. And obviously those that are coming through to our services are probably the most vulnerable, and therefore really important that we keep those infection control measures in place. And the social distancing requirements also restricts the amount of staff and patients that we can have in our buildings. We want to be able to build better for our population. In order to address some of the challenges around social distancing and infection control, we also rapidly implemented a number of digital offers out to our patients. And actually in doing so, it's been quite challenging for staff and patients to go through those changes. And what we'd hope to do is to make sure that we are addressing that and taking our patients with us on that journey, but mainly to ensure that we are seeing the right patients for the right care. So some significant changes we've had on the back of COVID have also led to a greater need to support our teams and ensure that we've got effective training space within the building, but also an opportunity to link up with other professionals in those changes that we've made. We also have a real need to ensure that we retain our staff, and having a positive and I guess fresh and purpose-built environment will both ensure that we can retain but also attract new staff. And going through this pandemic, we've learned a lot of things around how we deliver general practice services, some of them counterintuitive perhaps. So the impact on workforce about working flexibly and at home, understandably that's not for everybody, and it doesn't work well for delivering all the services, but there is some flexibility that we can explore and retain there. That we know that the demand from patients whilst coming through digital is maintained, and actually we're now seeing around a 20% increase in demand on general practice as an impact of perhaps moving through some of the changes over the last 15 months. And we know that the digital offer will take time to settle, but as Caroline referenced, we have made some changes to the design to be able to accommodate some of this, which wouldn't have been possible in the current buildings. But it's incredibly important that we maintain a proportion of that face-to-face capacity moving forward. And I guess just reminding ourselves of the focus on our population and the commitments that we made originally going into this scheme around the digital offer and attracting and retaining workforce. And we feel going forward with these plans is how we can deliver that. So lots of learning and lots to take forward. And I'm going to hand over to Jackie now. Thanks, you.
Alex. Next slide, please. So a little bit more about that future patient experience. Normally, patients access the surgery by telephone and by coming to the surgery, but we're part of the NHS long-term plan is also looking at other ways of accessing general practice, which actually allows more flexibility and choice for patients. And so a key component is the alternatives to face-to-face, and that will be present within the new Health Hub. So it's allowing patients to do virtual appointments. Now, virtual appointments can be done in a number of ways. It can be over the telephone, and it can also be by video consultation. So when we think about the Health Hub, we actually have changed and adapted those rooms to reflect those changes in how we practice. So there are 17 face-to-face GP consultation rooms, because that will still be one of the key components of general practice. There's also 8 face-to-face consultation rooms for our specialist services such as maternity and physiotherapy, but 9 virtual consultation rooms, and these are private spaces, but they're of a different size to allow for those telephone and video consultations that clinicians do. Next slide, please. So again, when we think about the future, often when people think about general practice, they will think about practice nurses, they will think about GPs, they will think about our reception staff. But actually, future general practice is much, much wider than those staff members. There are those that provide general practice services, and again, that is now wider. It involves paramedics, it involves other specialists such as physicians associates, and other members of that clinical team who provide that general practice care. Also minor procedures. These are again can be done within that primary care setting, both by staff within general practice, but also potentially by other visiting staff as well. Mental health services, extremely vital. I think the pandemic has definitely taught us how important those services are. And those services are both mental health provision within primary care, but also community mental health services. Physiotherapy, currently you've heard from Caroline, these are accessed in Bracknell, currently not on site. with the new premises, these will be available on site, including the facility to do exercises and rehabilitation using a larger gym space, which again gives you that opportunity for those group consultations as well and that group work. Maternity, we've mentioned how the maternity has unfortunately had to be taken back into the hospital at present because of insufficient space. It is absolutely vital that this is provided within that community primary care setting, and this building will be able to accommodate that, in addition to the specialist nurses. So if we think about that increasing age of our population, it becomes even more important to have specialist nurses in things such as diabetes, respiratory, cardiac, leg ulcer care. And there are also additional staff who work alongside the practices based across all of the practices within Ascot, and that allows us again to provide that better holistic care. So 27 more patient-facing staff across the 4 practices in Ascot, which means we'll be able to provide a much more comprehensive service for our patients. And health is nothing without our community. And so really important is that opportunity to work with our voluntary and community groups. You may be familiar with our PPGs, but actually this is providing a space for those community groups to help with our patients with getting better and recovering from illness. And again, that space is vital. I'm going to hand over at this point to Tash to tell us some patient stories which will reflect just how important this is.
Thank you, Jackie, and thank you everyone for taking time out of your evening to join us, particularly with the football on this evening. So yes, I wanted to present some cases which will really highlight the benefit of the new Health Hub for all our patients of all ages. So firstly, I'd just like to take a look at Mrs. Smith. Mrs. Smith is an 80-year-old lady. She's got bilateral arthritis affecting her knees. She's in chronic pain all the time. Her mobility has been decreasing and she's been suffering with fairly frequent falls. In addition to her arthritis, she also has diabetes and chronic leg ulcers, which require regular dressings done by the nurses. She lives on her own, and with all of these things, she's also really lonely, and social isolation is a massive thing for her since her husband sadly passed away. She doesn't have a car, and her only relative, her daughter, lives 2 hours away. She normally has to wait a long time for GP appointments because she has to have one of the ground floor consulting rooms. So most of the consulting rooms, both in Magnolia House and at King's Corner, currently all upstairs. So this is a common scenario where patients are not able to climb the stairs and have to wait for one of those rooms to become available. She currently has to travel by a bus to get to her physio appointment in Bracknell, and this usually results in having to get a taxi, which she can't afford. So that's the current situation for Mrs. Smith at the moment. However, the new Health Hub, as we'll see, is really going to improve things for Mrs. Smith. She'll be able to have her physio appointments at the Health Hub, not having to travel to Bracknell anymore. She'll be able to benefit from some of the group exercises that she'll be able to do in some of our larger rooms, and some of the group consultations again, which will be able to happen on site in the hub. She'll be able to see our social prescriber, who will be based in the hub, and they will be able to refer her on to community groups to help with some of the problems with her isolation. In addition, she'll be able to see the community diabetes nurse and also a dietitian. Again, both will be situated in the hub. And also, if she's actually no longer able to get to the hub for herself, her legs will be able to be dressed by the community nursing team. Obviously, this would happen at the moment, but the nursing team, the plan is that they will also be based out of the hub, and therefore will have a much shorter distance to be able to visit Mrs. Smith, thus freeing up their travel time and allow them to see a much bigger patient load. Currently, they're based in Bracknell for the Ascot patients. So next case, I'd just like to talk about Tom. Tom is 35. His marriage sadly broke down after being made redundant, and he has 2 small children. He has depression and started drinking heavily, and has recently lost his driving licence. So Tom has been referred to the local alcohol team. They are currently situated in Maidenhead. So Tom's only option for getting there is a taxi or a train from Ascot, or a bus, which would take about an hour, over an hour and a half as stands. At the moment, he's needing to see his GP every 1 to 2 weeks for support, and has regular appointments with the drug and alcohol team. So you can see the situation for Tom is really quite challenging and expensive as it stands. So looking towards the future, we hope that we would have some of the counsellors from the drug and alcohol team, or at least one actually situated in the hub, to help him with some of his alcohol issues. He'll have some engagement with talking therapies, and will really benefit from having a local talking therapist also based out of the hub. In addition, he'll be able to attend group sessions on stress management in some of the group therapy rooms, which we hope to have situated. And again, thinking more wider, he will be able to access citizens' advice to help with some of his financial issues. Again, not having to travel, because this will all be in one base for Tom. And lastly, just coming on to Jane. So Jane is a new mum. She had her first baby. She's 35 years old, and she's married, but with no close family around. She had very limited contact with the antenatal team, and this is because at the moment they are based, so all the midwives are based in Frimley Park. Again, currently as it stands, very limited contact with the health visitor, and that she's supported remotely. She's really suffering from anxiety and lack of self-confidence, and also isolation. Because of her situation, she's become increasingly reliant on the services of GPs, and part of the problem is there's limited possibility for those GPs to liaise with other healthcare professionals, particularly with the maternity, with midwives who are not located in the same building. So for Jane, there's going to be a huge benefit from being a patient at the new hub. So there will be midwives will be running their clinics actually out of the same building. We hope the health visitors will also be based in Ascot in the hub. And one of the real benefits will be the joined up working between the whole team. And I can't put a price on those conversations that you can have with a midwife, with a health visitor over a lunchtime to discuss patient care. And as I say, at the moment, we don't see the midwives, we don't see the health visitors, because there's such a long travel for them. So that idea of a really integrated care for all our patients, but particularly for someone like Jane. And again, she will also have the benefit of talking therapies and of an integrated mental health officer who would also be based there. And I think, thinking the wider picture as well, we really hope that we can use some of the space for groups, for example, mother and baby groups to meet, to use some of the outside space again for exercise groups, and to really help with people who are socially isolated and need some more community support. Thank you. Now I'll hand over to James.
Excellent. Thanks, Natasha. Just before James comes in, Lydia, thank you for your question. Just a reminder to the rest of our viewers, please do put your questions into the question tab as we move through the presentation, and we'll look to answer those at the end of the session. James, over to you. I think James is probably having 1 or 2 technical difficulties, in which case I suggest we progress on from this slide. And Mark, if I bring you in instead, and we'll go through the the scheme itself and the key changes and improvements be made, and we can come back to James's slide of the minutes. Mark, over to you.
Sure, thank you very much. So as I said before, I'm from Murphy Phillips Architects, and I'm going to talk through the design of the building. We'll start with the history of the planning applications on the site, and I want to talk a little bit about two previous applications. So the red dotted line indicates the boundary of the site, and the red outline here indicates the application that was submitted in 2017. And this was for a single-storey building of just over 2,000 square metres. Subsequent to that, and shown in the blue outline, was the next application submitted in 2020. This was a slightly larger building, but positioned over over a ground and a first floor. So the total area was just over 2,100 square metres, but you can see from the movement here is the building is moving further towards the care village boundary. The hatched blue area centrally shows the position of the first floor of that application. So having moved on from that and having taken into consideration a lot of the issues and comments that were raised as a result of those applications, we've developed a new scheme, which is shown here in the green outline. And through the efficient use of accommodation and looking at really embracing integrated and holistic working, we've looked to streamline the accommodation to reduce the overall area to 1,750 square metres. Now, in addition, we've looked to locate the building further into the northwest corner of the site, so that it's further away from the entrance to the site from Rise Road, and also further back from the houses along Linwood Crescent. So that's the footprint for the ground floor. And you can see here the hatched area is the area of where we have a first floor area, so the second story of the building. And again, we have made sure that rather than locating that centrally within the building, again, we've set that to the rear of the building. So we're working hard to reduce the visual impact generally of the building. We've also reduced the elevation, so that's the width of the building that can be seen from the entrance as well. So if we move on to the site plan, you can see here an indication of the building in the top left-hand corner of the site, the parking area and the access to that. And I'm going to say a few words about each of those. So really all of those are positioned on the site to minimise the amount of site that we take up. And you'll see that the majority of the site to the south is left untouched. And the benefit of that is it provides lots of natural screening in terms of the landscaping and the trees that are already on site to screen the development as much as possible. It's laid out, as we will see, to emphasise the smaller scale components, and we've tried to reduce the feeling of mass and how that is put together, and I'll show you that in a few slides' time. Now, around the building, we have certain areas of hard landscaping. That's obviously the parking areas. But as has been mentioned before, it also gives the opportunity for some outdoor spaces that are accessed directly from the gym and the group spaces so that they can be outdoor exercise. We've incorporated benches and trees wherever possible to make sure that, as well as having pleasant spaces outside the building, along the route towards the building, there's a place to rest along that way. The building has been positioned in a way that is set back as far as possible from houses, but also to retain as many trees as possible. And we're balancing that with the planting of new trees as well. In terms of the access to the site, we have three separate and safe routes. So shown in blue, there's a direct entrance from Rise Road, and it's purely a pedestrian route that leads directly to the main entrance, the front door of the building. Adjacent to that, but separate, is a cycle lane, which leads to a safe and secure bike storage, again, close to the main entrance. And in orange, you can see the parking areas, and that's 101 parking spaces. The access to the parking area, as you can see, takes something from the previous application in that it's not a direct access, but involves a turn, so that the view along that vista from Rise Road is of vegetation and not directly across the parking areas. We've tried to keep that as discreet as possible. In terms of the parking areas itself, again, there are some landscaped elements within the parking itself, so there's opportunity to plant some trees. And also there are 5 disabled parking spaces, and those are located, as you'd expect, as close as possible to the building. Okay, so looking at the building itself, of course, the purple and yellow here are not the intended colours of the building. Those are just to very graphically represent the 2 different materials that we're proposing. So the purple is currently represents timber cladding, and you can see some precedent images of some other buildings that we've been involved with previously. And the timber cladding is a really good opportunity to introduce a natural and sustainable material to the facades of the building. And it gives us the opportunity to detail it in different ways, so that increasing the texture and the human scale of the development. We've looked at breaking the mass of the building into separate components, each with a pitched roof. So actually the building itself is a composition of components that are very similar in scale to the nearby residential properties. Around the main entrance, we're highlighting the fact so that it's very clear in terms of wayfinding to find your way to the front door, in terms of a larger area of glazing so that one can see directly into the building, and also an extending canopy for shelter along there. The yellow single-storey part of the building, which extends further towards the main road, the intention is to design that in brick. Firstly, to differentiate materials, and you see a precedent photos here of a natural brick with variation within it. So, in terms of the ground floor plan, I want to say that we've worked really hard with the GPs and some stakeholders and users and the CCG to develop a footprint and the layout of rooms that really maximizes the integrated and holistic working that's being described, so that it can provide integrated care to those who use the building. We've worked hard to develop clear and intuitive routes for patients, so that it's very clear upon arrival at the building where one needs to go. So there's a clear view of reception, there's a clear view of the various corridors that lead to the clinical clusters. It's also laid out in a way that supports efficient and effective staff working patterns. And we have developed the plan so that it maximizes natural daylight wherever possible. So elements of glazing to bring light into the public spaces of the building. Corridors have windows at the end to get light even into the circulation routes. And we've introduced sub-waiting spaces along those routes, so that there's an opportunity for sub-waiting closer to the clinical areas. So to get your orientation, the light blue areas of the building are where the GP clinical rooms are kept, and there's also a minor procedures room within that. The purple side of the building are the specialist services that were described before, maternity, physiotherapy, and the gym and group rooms, which, as I mentioned before, open out into some outdoor space as well. The plan is fully accessible for wheelchairs. So in terms of the concept of that layout, so this is the ground floor, but shown in terms of the concepts of what we're doing. The layout is based on current Department of Health design guidance, healthcare environment research, and also evidence-based design to make sure that it's an effective and therapeutic environment for all who use it. We've made the building as efficient as possible by introducing flexibility and adaptability to the size and the position of all of the rooms, so that it's fit for purpose and meets the current standards, as we well know in terms of the recent year and a bit, in terms of infection control and future-proofing and making it adaptable for pandemic situations. And the way that we've done that is we've made sure that all of the internal spaces can incorporate an element of social distancing. We've looked at how to address one-way routes through the building so that people don't cross paths. So by using the glazing at the end of the corridors, we introduce exits there so that people can move through the building in separate ways and not have to go back on themselves. The other things we've looked at is how we might segregate symptomatic and asymptomatic patients to make sure to minimize contagion as much as possible. And of course, it will be developed to have easily cleanable surfaces and being easy to maintain. And the rooms themselves are sized to adopt a wide range of activities. So we've worked with all of the users to make sure that these can really maximize the activity that's able to take place within them. So all of the public areas and the patient spaces are situated on the ground floor, and it's staff access only to the first floor. And this is accessed through lift and stairs. And this includes all of the admin areas, so all of the offices, meeting, training areas, and the staff facilities, the changing rooms, and other staff facilities. Again, this is fully wheelchair accessible, and we've introduced natural light wherever we can to all of those spaces. So all of the rooms throughout the building that people will have appointments or people will work in, they all have an external window. So this is the concept for the first floor plan, and we've worked with all of the users to support the integrated and collaborative working that you've already heard described. We have working areas which are open plans, which enable people to working in the appropriate clusters for multidisciplinary working, but also a range of separate breakout areas for more confidential conversations, either one-to-one or for individuals. And along the top of the building, those are the 9 virtual consultation rooms, which can also be flexible in purpose. They can be used to conduct virtual consultations, either by video or over the phone, but they can also be used as quiet working spaces as well. So, of course, this building will adopt, the highest levels of sustainability, and there are lots of targets that we look to meet and indeed exceed. So, on the right-hand side, you can see some of the targets that we're aiming for. So, one is to exceed the target of the building regulations recently updated, which is Part L2A. So that deals with energy efficiency. The planning policy, new policy guidance is to reach a net zero carbon building, and we're developing the building with that in mind. Lastly, the other target is set both by the Planning Authority and by the Department of Health for new buildings of this nature. And there's a BREEAM assessment, that's the Building Research Establishment, which is the body that put the assessment together, environmental assessment method. And this is a way that looks at not just the energy consumption of the building, so not just energy efficiency, but the way in which the building is built and constructed, where the materials come from, where labour comes from. It's how the building is operated in the future, sustainable travel plans, it's about recycling. So it really looks at the full lifetime of the building. And the targets that we were on target to meet is an assessment of excellence. And you can see on the left some of the strategies that we've implemented in the building in order to achieve some of these. One of which is the solar panel array that will be on the roof, as well as other renewable energies. So that's the end of my description, and I just wanted to say we think this is a really exciting opportunity to provide a very, very sustainable and innovative health hub in this area. Thank you.
Thank you, Mark. We now have James back, so I just suggest before we move to the Q&A that we make our way ever so briefly back to his slide. I think we have James. Okay. James is still having a few technical issues, so I'm going to bring his colleague Sarah onto the stage. One moment, you can just bear with me. Okay, hi Sarah, thanks for stepping in. If you could just talk us through James's slide, if you wouldn't mind. Thank you.
Yeah, not a problem, Nick. Evening all. Just to briefly touch on the planning side of things. So as I'm sure many of you know, an application was submitted by the CCG in April 2020, which covered the redevelopment of a community health hub. Following the review that you've heard tonight from the CCG in light of COVID and the other reviews they've undertaken, in addition to Mark's revisions to the plans, we'll be looking to resubmit revised information under that current application in due course, which will relook at things like the very special circumstances case, which is, as we all know, the site is located in the green belt and within a allocated green gap in the neighbourhood plan. So we'll be revisiting the very special circumstances case, as well as some of the technical documentation in relation to trees, transport and ecology, to make sure that the revisions to the application are all up to date and in line with the latest planning requirements. So we'll be looking at that as a result of this event and feedback that was also received during the course of the previous planning application from stakeholders in the community. So we're looking to really incorporate that all into one revision to the application, which will be submitted to the local authority in due course. I think, Nick, that's probably enough on planning. I'll leave it to the interesting stuff. So I'll move on to the Q&A.
Fantastic. Thank you for stepping in, Sarah. We'll just go back to the Q&A slide, and then we'll start taking your questions. As I said at the start, I'm going to look to take those in themes, and I think we'll start with just having a quick look at the facilities. We've had some good questions come in here from Lydia and Patrick. Caroline, if I bring you in on Lydia's question, will the new hub include a permanent base and provision for local parents with children under 5 to access health visitors and their professional expertise to ensure the best start in life?
Yeah, that's a great question, Nick. Thank you. I think one of the things I would say here is that we've had to think really carefully about permanent bases for staff, because we had a lot of feedback on the previous applications about the size of this development. And so we've had to do quite a lot of work to make sure that the size fits in the services that we absolutely need to have locally, while still having availability for other staff to have touchdown space and be able to meet other professionals face to face. So the approach for staff like health visitors and district nurses is about touchdown space rather than permanent bases, and the availability of the group room for sessional use. So health visitors wouldn't be permanently based here, but the building's available to them, the facilities are available to them, including use of the staff room, the kitchen, things like that make working in the local area easier. So that's been our approach to manage the balance of those challenges that we've faced with this development.
Excellent. Thank you, Caroline. Lydia, I hope that answers your question. We'll stay on the same theme with facilities, coming to Patrick's question. And Mark, I think I'll just bring you in here to clarify this point. Will the new hub have an accessible toilet/changing room with a change bed and hoist so that my severely disabled daughter is able to make use of the facilities?
Sure. Thank you very much for the question. The answer is that currently it does not have that facility. We are aware of the Changing Place initiative. I think that's something that we should definitely raise and look into.
Excellent. Thanks, Mark. So I think that's, Patrick, something we need to reflect on and come back to. We've had a further question come in from Dilly, who asks, and Caroline, probably one for you, will this hub be open 24/7?
So not 24/7, probably. The likelihood is that it probably would be open something like 8 till 8 on weekdays and at some times during the weekends as well. Some of that will depend on the extent to which community groups and voluntary organisations wish to use it out of hours, but it would also be the location for extended hours general practice. I may need to defer to colleagues around what hours those currently run for Ascot, but they're based. But I think they're based in Bracknell. Would a colleague like to indicate that they have those hours at weekends to hand at all? Alex?
We do have the extended hours offer both Monday to Friday till 9 p.m, I believe, and then at the weekends, Saturday with longer hours and Sundays. I'd have to look up the exact hours and I will come back on, Nick, if that's helpful.
Fantastic. Thank you, Alex. We'll come back to that. We've had a couple of questions come in regarding the timescales for the project. A question, Caroline, perhaps in the first instance, a really positive question. How soon will this project take off, and when is the expectation that it will be completed and in use?
Well, clearly that depends on a successful planning application, and we do need the community's support with that planning application. But I think we are probably a minimum of 2 years away from a built building, but it is all dependent on the various stages. I think probably beyond planning, then we would need to develop what's called the final business case or a full business case, where all the technical details of the scheme are finalised, and then there's procurement of the contractors and the actual build period. So that would probably be the absolute best case scenario of 2 years.
Fantastic. Thank you, Caroline. And Lucy, thank you so much for your positive comment. I hope that also answers your question in relation to timescales. We're going to move on now to a different topic. I think I'd like to take highways next, parking and transport. We had a few questions come in. A question here from Elma. Will car charge points be installed? I know the answer is yes, but do we have a number yet that we can confirm? James or Sarah, perhaps, are probably best placed.
Yeah, should I kick off? So the expectation is there'll be 20% electric charging points included within the parking, and then also the infrastructure will also be included to ensure that that can be increased over time as demands increase. So sort of a 20% start with the application, but the infrastructure to go to 100% in the future as and when required.
Excellent, thank you, Sarah. And sticking with you, Sarah, I feel a further question from Elmar. Will you work with the Highways Department and Council to reduce the speed limit on Rise Road from 40 miles an hour to 30 miles an hour?
Yeah, so this was something that was raised in previous applications, and we know it's something of interest to the community, and it has been raised as a concern. That will form part of technical discussions between the CCG's transport consultant and RBWM's technical highways team. So there will be principles agreed as part of the planning application, and then any details agreed as part of that will then be worked through in detailed design post-planning.
Excellent, thank you, Sarah. And I think Alex, you've now got a response to the earlier question in terms of opening hours. If I just bring you back in to help with that one.
Thanks, Nick. Yeah, so I think the question that was posed, the information requested, was around what's the current extended hours offer for residents in Ascot. It's based at Boundary House in Bracknell, and it's open till 8:30 Monday to Friday, and extended hours on a Saturday is 8 a.m. to 2 p.m. with Sunday morning appointments also available, bookable through general practice. So that's the current offer. Thanks.
Fantastic. Nick. Thank you for clarifying that, Alex. Okay, moving again onto a different topic. We're talking here now about Linwood Village. There's one question here about parking in particular, but also about leasehold obligations. I'll take Georgina's question first, and I think Sarah, probably I'll come back to you. Part of the site is currently used as a car park by Linwood Village employees. Between 20 to 30 cars are parked on the site Monday to Friday. Where will they park if this project goes ahead?
Yeah, thanks, Nick. So the car park that is currently on the site is in fact an unlawful car park. So that was meant for a temporary period, I believe, for construction linked to Linwood, and should have been reverted back. And now we're not involved, but I understand that the council have approved an application for an additional car park on the Linwood site, and that is mid-construction from what I understand. So Linwood will be using that, but it's clear that the CCG and Linwood are clear that the proposals and the proposed car park within this scheme are for use by staff and patients only, and there's no allocation within these proposals from the CCG to allow any Linwood car parking on the site.
Fantastic, thank you, Sarah. That's a really helpful question, and I hope that clears that up for you, Georgina. I've had a question here from David. I'll put this to all of the speakers, so please jump in. Who will be the leaseholder responsible for the leasehold obligations, including especially the rent, maintenance of the building and grounds, and dilapidation at the end of the lease?
I can make a start, Nick. So the landlord is likely to be responsible for some of that, but that is something that would be worked through at the final business case stage, so the next stage, rather than something that we have specifically dealt with right at this point. I think one of the challenges for us is that we are in undergoing an NHS restructure at the moment. The legislation is going through Parliament. The responsibility for this kind of estate and development may change as a result of that legislation, and so we would want to see what's actually in the detailed legislation before we entered into those detailed discussions. But it is an important question, and one that we'll need to resolve at the next stage. I think if there were any particular concerns about that area, we'd be happy to pick up. If there was something behind the question, we'd be happy to answer that. But that is, I think, the current status.
Thank you, Caroline. Clearly some moving parts, but a really important thing that the team are looking at. David, if you want to pick that up off this webinar, you have our email address and our telephone number, so please do get in touch, and we can certainly talk to you in a bit more detail. Brian, moving on to your question, very exciting. Thank you. I'm sure everyone will be pleased to hear that. Mark, I'll put the first part of this to you. Is the plan based on a generic design for this type of facility, or is it a one-off?
I agree. It is very exciting, and the reason being that whilst it's based on Department of Health guidance, that really just relates to room sizes and proportions and things. So it's definitely a bespoke solution. And I go further and say that really it's an exemplar and hopefully a prototype for buildings of this nature. From the bespoke perspective, it responds to specific site factors in terms of, a low-lying building that minimises impacts on the environment, both visually but also sustainably. And we're reaching targets of sustainability that wouldn't, are just beginning to come through as policy. So a net zero carbon building for a health centre is a great kind of new opportunity. Also, the models of integrated working is something that's really kind of pushing the boundaries, and certainly addressing COVID. This is something that we are seeing across the range in all of our healthcare buildings, and we specialise in healthcare. And this really addresses, very neatly a lot of the criteria that are coming up. And I think most importantly, it's not therefore designed for a pandemic. it supports both a pandemic and a non-pandemic scenario, I think quite successfully. So it's really exciting.
Thanks, Mark. That's a really great answer, and Brian, I hope that helps. There was a second part to your question, Brian, and if I read this out, I'm sure I get lots of smiles from our speakers. Why Sunningdale? I live in Sunning Hill. I think it's another one about the names we might be looking at and how we can involve members of the community going forward. Caroline, I know you've spoken on this before. Do you want to perhaps just come in and shed some light on the name?
Yeah, Jackie might also have an input. So we needed to choose a name for the planning application, but actually, you know, we're not wedded to this, and if people have got better suggestions, or maybe we'll run a mini competition at a later stage in the process. But we had similar feedback from others, so it's something that we're open to thinking through. Does Jackie want to?
Yeah, I can absolutely agree on that, Caroline. This isn't the final name, but you have no idea the amount of debate we've had about this already. It's really hard. It's really hard. It's a big responsibility coming up the name. And I keep thinking of Boaty McBoatface. So it's something we have to really be thinking about. What is that suitable name? We will land on something. We keep picking brains of our patients as well. All suggestions gratefully received, but there will be an ultimate name that we'll come up with for the practice. This is just purely for the moment, partly because it's easier to decide world peace issues, I think, than the name of the building. Very tricky.
Thanks, Jackie. I think, Brian, watch this space, and if you have any suggestions, do please get in touch, and that applies to everyone else. Okay, that's the end of the questions that we have come through so far. We'll just pause now and wait for any further questions. Okay, I could see a question from Gary. Will a recording be available for those like me who missed some of the webinar? Absolutely, Gary. This is being recorded, and we'll be putting a copy of the recording on the CCG website, and also a copy of the slides. So please go and take a look at that over the next couple of days. Any questions, please do get in touch. Peter, a question from Peter. How do you anticipate our community advocating approval for the plans? I think I'll bring some people in on this in a minute, but Peter, I think that's a really important question. I think we are looking for the support of the community, and we really appreciate the support that's been shown. I think when the revisions are submitted, there'll be an opportunity to again highlight your support, and we'll be in touch with those who do support the application, and we really do call on people to write in support. Does anyone else want to just quickly make any comments in relation to Peter's question? Okay, no, I think
Tasha's got her hand up.
Natasha.
Yes, no, just so, I mean, we're so grateful for everyone who's historically written in to support the project, and maybe Val Williams can clarify, but whether obviously letters of support which are with the existing application will be carried over or not. But yeah, I mean, we'd really encourage people to write in with whatever their views are, and we are patient groups who we're extremely grateful to, both at Magnolia House and King's Corner, have been hugely supportive to the practices throughout this. They will they'll be spreading the word, and there'll be information on our practice websites about that as well.
Tash, just to clarify on that point, so as we will be submitting a revision to the current application, the comments which have already been submitted from the April 2020 application will still be relevant to this. The application number will remain the same, which, as Nick says, we'll put out there when the information, the revised information, is submitted to the council, but it will be the same application number, so people can comment now, in the future, whenever they so choose. But Nick will be providing an update when that information has been submitted. But it's all available on the council's website at this point in terms of the previous application number.
Excellent. Thank you, Sarah. Okay, we just have one question from David asking for clarification on the email address. I'll just have to double check that. So give me 1 second, David, and I will confirm that for you. Okay, so the contact details, David, email address, and I can always send you this on email afterwards, is eastberks.ccg.inquiries@nhs.net. And there's also a free phone telephone number as well, which is 0800 689 5209. And again, I'm more than happy to contact you tomorrow just to share that again with you. Okay, we'll just again reflect and pause for a few minutes in case there's any further questions. Okay, just to say, David, I've just put that email address into the question tab in response to your question. So again, everybody, if they scroll back up to the top to David's question, will be able to find that email address as well. Okay, well, if there are no more questions, I think we'll conclude the session here. Plenty of time for you to all make it to the football at 8 o'clock. Thank you for attending this evening. Thank you for your questions. Thank you for your support and your comments. And thank you also to our speakers this evening. As I said, a recording will be made available on the CCG website, as will a copy of the slides. If you have any questions, please do contact us and do not hesitate to get in touch. Okay, I'm going to end the session now. And again, thank you for attending. Good night.